Welcome to Canadian Doctors Speak Out, where we're going to give you the top reasons not to be afraid of COVID. When we hear the word COVID or coronavirus, we now instinctively reach for a mask or look around to see how we can protect ourselves and our families. No place really seems safe. But as Canadian medical doctors, we're going to tell you what the best science now has to say, and we think you will be pleasantly surprised. On the TV, we hear cases, which would frighten anyone, but cases are not necessarily symptomatic people, and the vast majority have few or really no symptoms of being sick. They just have a positive PCR swab test. Research now shows that the PCR test is practically worthless. Only 3% of patients with a positive test actually have the COVID virus. People have died, yes, that's true, but using case numbers gives a false picture of what is really going on. Here's a graph showing the COVID cases reported each week in Canada. Even I get frightened looking at this graph. But now let's put the weekly deaths on the same chart. Where are all the deaths that we would expect to follow the cases curve? Something is really fishy here. Let's look at yearly deaths in Canada from 2001. It's pretty hard to show that we've even had a pandemic. The slight increase in 2020 was probably due to an aging population. But aren't hospital intensive care units overloaded with COVID patients? If we look at the Ontario Intensive Care Unit data, there are fewer patients in the ICU in 2020 than in each of the previous 3 years. The CDC's own data compares COVID to seasonal flu. In children, COVID illness is so mild, their death rate is statistically zero. For people under 50, the infection survival rate is greater than 99.98%. And for those over 70, it is 94.6%. And that is without any early treatment whatsoever, like vitamin D or vitamin C. So if you're young, you really don't have anything to worry about. If you're older, well, we're going to give you some really great ideas on how to protect your health that do not include getting a shot with the vaccine.